Well, unfortunately, infertility affects more couples than ever before. And to help us with that, right now we've got Dr. Joyce Johnson with Weber Naturals. Hello, Dr. Joyce Johnson. Good to have you back on our program.
Thanks for having me.
So it's a bit of an issue, infertility. Okay, so the word, I mean, it's pretty, I guess, common knowledge what infertility is. But what does it exactly mean to be, I guess, is infertile? Would that be the word, or?
Yeah, well, infertile kind of is a definitive diagnosis, where some people that are suffering from infertility, there might be different causes that can be treated medically in order to alleviate that. Sometimes you get individuals that it's unexplained infertility, which means both male and female have both gone through the tests and everything has come back clear. So it's unexplained. So there could be other factors that are involved. But yeah, infertility, generally it's a year of trying to make a baby without success. For women over the age of 35, it's defined as 6 months. So they don't want you to continue to wait the entire year before seeking help.
Okay. Now, how big of a problem is this? Because I did mention off the top that it's growing to be bigger and bigger.
It is. About 1 in 6 heterosexual couples or couples are trying to get pregnant. They're experiencing that. Okay.
So what is it then that's making it so it's all of a sudden like worse than ever?
I know. There's a lot of different factors that can play, and I think the medical field is not at a standstill, just there's so many reasons. It could be that most women or a lot of women are waiting until they're older after their careers have started before trying to conceive, right? So the older you are, the more difficult it then becomes. They could also relate it to environmental toxin exposure. They found there might be more estrogens even in our drinking water, so that can play a role. So there's a lot of different factors that can play. It can be something like thyroid condition, autoimmune diseases, stress. Stress can play a big role.
Yeah. Stress isn't good. It's not good for so many things.
Not at all.
It was primarily seen as a women's issue, but now it's so is it 50-50 now? What are
I think the stats specifically are 40-60.
Okay.
But anyways, men are involved. You know, there are factors that can play a role in the health of a man's sperm as well. So yeah, it's something that's shared, and it's important that both partners are seeking medical attention, and and I think that's the way that most couples are going now. Not all of the onus is being placed on the women.
Okay, which is good.
We've come a long way.
Good. All right, you're obviously here with Weber Naturals, and you brought all kinds of help with us, with you here to help out fertility issues. So would you like to start? It looks like food is something that
we'll
people
start
should
with
consider.
Food. I think it's really important that you're eating foods that are nutrient dense, foods that look like what they did when they were first grown. You're trying to unprocess your diet, trying to get away from refined foods. You want to eliminate sugar from your diet, and if you can't eliminate sugar completely, try to just get into more of a clean diet. Some specific foods that are really great are avocados. They're high in folate, healthy fats, and fiber. We know folate or folic acid is important for preventing neural tube defects in babies. The next is spinach. So spinach is really great. Again, it's high in folate and phytonutrients. It also has some beta carotene in it as well. And blueberries, these are high in antioxidants and fibers. It's really great. You can put those in a smoothie, which a lot of people are already doing.
All right.
And then also multivitamins. So when you're looking at a nutrient deficiency potentially can be the cause of this unexplained infertility, then you want to make sure that you're getting at least all of your essential vitamins and minerals that you need on a daily basis. So look for one for a man, one for a woman as well.
Okay, there should be both genders should be taking
multivitamins. Absolutely, and we're made differently, so our requirements are a little bit different.
Okay, and I mean more vitamins.
Yeah, these are a little bit more specific. So research has found that women that are consuming omega-3 tend to have higher success rates at conception. Coenzyme Q10, this is a supplement that both men and women can be taking because it does help with the quality of the sperm and the quality of the eggs. And even vitamin D has been shown to be really important in egg development in women.
Okay, all
yeah,
right.
and we know that there's a lot of other health benefits to things like this, right? There are cardiovascular benefits, and
so not just for fertility issues.
And we live in Canada, so vitamin D if the sun ever,
yeah. Okay, now I'm seeing you're like, what is this now? Like we're getting sexy and setting the mood? Is that what's happening?
Well, I suppose it could with the eye mask. There's
well, I mean, and you're getting in shape, and you've got like some lovely scents. But I'm guessing this is for different reasons.
Yeah, but whatever.
Yeah, sure, whatever
that
works,
works.
Right?
Chronic stress. Chronic stress can be a really big issue when it comes to the ability to conceive. So it's important that you're managing stress, that you have tools to be able to manage stress. Maybe it is eliminating things like caffeine in your diet. That can help to calm you, right? So switching over to some herbal teas.
Okay.
Making sure that you're exercising. Exercising is a really great way to, stimulate blood flow to all of your organs. So sweating is also a great way to detoxify your body.
Okay.
So you want to do 30 minutes, like 5 times a week. And make sure you're getting to that point where you start to sweat.
Okay, we only have about 45 seconds left, too, so I know that you want to get to this as well.
Okay.
I know there's plenty to get to.
Yeah.
30 seconds?
Lastly, this is just changing some lifestyle things. So trying to eliminate toxins and chemicals in your house. So these are just some natural body care products that are low in toxins.
Okay.
Switching over to something like stevia, like I was talking about sugar earlier, and just a glass, right? So we're talking about trying to eliminate plastics and plastic storage containers. So that's eliminating some of those BPA, the toxins that we know are hormone disruptors. So switching that over a bit.
I got to wrap you up here, unfortunately, but more details, tips, WeberNaturals.com.
Thank you.
Of course. Thank you very much, Dr. Joyce Johnson, as always. And more daytime coming up on Rogers TV.